I'm Dr.Elodie Archier. I'm a dermatologist and onco-dermatologist at St. Joseph Hospital in Marseille. Cancer treatments are responsible for several types of skin side effects. These side effects are extremely varied in nature. They can include pigmentation disorders, erythema, itching, or skin dryness. It will all depend on the type of molecule used. Over the past decade, we've been witnessing a genuine therapeutic revolution in the field of oncology, with the advent of new, increasingly effective medications. The three main families of treatments currently used in oncology to treat cancer are conventional chemotherapies, targeted therapies, and immunotherapies. Obviously, each family of molecule will be responsible for specific side effects that will require specific treatment. The skin side effects of the molecules used in oncology will depend on the family used. Conventional chemotherapies, which have been used for a very long time and for which we have the most hindsight, will have side effects on the skin as well as the appendages, i.e. the nails and hair, with hair loss of course, which is a known side effect of conventional chemotherapy, and also with side effects on the skin, including skin dryness, which we need to know how to prevent. With targeted therapies, which are more recent, and modern cancer treatments, there are also side effects on the skin and the appendages, with skin rashes and dryness, and with damage to the nail area and the extremities that can be highly disabling when it leads to cracking, which will require suitable treatments. Lastly, immunotherapies, which are the latest generation of treatments used in oncology, can also cause skin rashes and erythema, redness and dryness. These often occur in the first months of administration and can be difficult for patients to tolerate. When a cancer treatment is administered to a patient, all areas of the body can be affected by side effects involving the skin or appendages, i.e. the hair and nails. There can be effects on the entire body, which is why it is important to observe some general rules of prevention to avoid the occurrence of skin side effects. The treatments currently used for cancer have very different modes of action, depending on the family of molecule used. Depending on the type of molecule used, the side effects on the skin and appendages will be different. When we use targeted therapies, for example, we know that certain families of these therapies will have side effects on the skin that can be correlated with the treatment's efficacy. Even though these skin side effects can be difficult for patients in their everyday lives, we as onco-dermatologists, when we see them for consultations, explain this correlation with the efficacy of their cancer treatment. And this often enables us to be more effective when recommending suitable care products for this type of side effect. People undergoing cancer treatment need to be told how to prevent the occurrence of skin side effects. The main piece of advice we give to patients who will be or are being treated with chemotherapy, targeted therapies, or immunotherapy is that they should moisturize their skin. Dryness is the main side effect and is not specific. It occurs with all the cancer treatments used and will need to be prevented by moisturizing the skin on a daily basis and also by cleansing with ultra-rich cleansing bars. Having appropriate daily personal hygiene routine is very important to prevent these skin side effects. It's very important to know how to prevent and treat the skin side effects of cancer treatments for several reasons. The first is that, unfortunately, we're often required to interrupt a cancer treatment, even if it's proven effective, because of toxic effects on the skin. We can also be required to reduce the dosage of certain cancer treatments due to the skin side effects. It's essential to be able to properly treat these side effects and inform patients that they exist, so that they may put into place daily routines to keep them from becoming too disabling. The second reason, of course, is the impact on the quality of life of these patients, who are very bothered from day to day by these side effects that can be very painful. Anticipating them is also a way of improving the efficacy of their cancer treatments and their daily quality of life. To supplement cancer treatments, which of course remain essential, we can use dermocosmetic care products that help prevent the occurrence of side effects. One of the first things to do is to apply a moisturizing cream. Moisturizing cream is ideal for avoiding skin dryness induced by chemotherapy molecules, targeted therapies, or immunotherapies. Obviously, sun protection is also important for patients undergoing cancer treatments, because these treatments promote sunburn, particularly in patients treated by chemotherapy. So we need to tell them to protect their skin from external stress and from the sun in particular. Dermocosmetic products should be applied to various areas of the body and at different times during cancer treatment. It's important to remember that the prevention of skin dryness, for example when administering chemotherapies, is essential and should start before the administration of specific treatment. That's why it's important to consult your dermatologist to find out what products to apply. You should also properly moisturize your skin. Moreover, you should protect yourself from the sun from the start of your cancer treatment. We need to explain to patients that they should protect their skin before, during, and sometimes also after treatment, because many cancer treatments act over long periods, and even once they have been stopped, they can continue to have side effects. The daily hygiene that is recommended for patients who are undergoing or have undergone cancer treatment will of course depend on the type of treatment administered. One thing that should not be neglected is daily application of moisturizer. We also recommend cleansing with ultra-rich bars of cleansing oils instead of soaps, which are harsher on the skin. We also recommend, and this is very important, thoroughly moisturizing your extremities and paying attention to your fingernails and toenails when you're being monitored for cancer treatment to avoid these side effects that can be highly disabling. To improve the quality of life of patients undergoing cancer treatments, we of course have dermocosmetic care, but that's not all. We also advise them to have the healthiest possible lifestyle with a balanced diet. There's a lot of talk about diets today. None have demonstrated real efficacy in terms of anti-tumor activity. However, it's important to eat a healthy and balanced diet. That's essential. Lastly, we advise them to exercise. It's very important to exercise when you're being monitored for cancer and undergoing cancer treatment. Of course, the activity should be compatible with the person's capabilities, but it's been shown that regularly exercising during cancer treatment improves the quality of life and even the life expectancy of patients. It's therefore important to add a suitable form of regular exercise.